Welcome back. Healthcare. It is something we all need, but it is also something many families struggle to afford.
The state just released some new data that gives us a clear picture of exactly how many people are having difficulty. NBC Connecticut political reporter Mike Savino joining us live from the Capitol. Mike, how bad is the problem?
Well, Keisha and Mike, it is certainly not a good situation. And actually, the worst of it is for families who get their insurance through their workplace. And it has many people saying it's something the state really needs to address.
I take about 50 pills a day. And with doctor's appointments, I have a little say I'm always on call because they can call me any day, anytime if blood work doesn't look right.
For 15 years, Dennis Thomas has been living with a heart transplant. And for much of that time, he's been battling colon cancer. He's also been trying to pay for the massive cost of that transplant.
Probably over $1 million.
What we found, as you've seen, is that there is a significant chunk of families who are struggling specifically to pay all of their health care bills.
A growing number of families is finding it hard to pay their medical bills. 13%, or 1 in 8 here in Connecticut, according to new data released by the Office of Health Strategy. And the families most struggling are those who get insurance through work. In many cases, those are high deductible plans.
We have higher levels of medical debt here in Connecticut, which is another reason we need to get a handle on our rising health care costs.
The Office of Health Strategy has been trying to tackle health care costs. This includes setting benchmark goals for increases and trying to understand why prices for drugs and hospital visits just keep going up.
Our office is very focused on transparency and helping people understand, as we were just discussing, what's driving the costs.
OHS will soon release recommendations. Those will likely be around transparency, helping patients understand what goes into those bills so they can make better choices. The agency is also working with providers and insurance companies. Thomas says this needs to be a priority for all policymakers.
It starts with the people in our community, you know. It starts with partnering up with legislation to get this stuff done.
Now, Thomas says he actually gets better coverage now that he's on Medicaid, but he's still paying tens of thousands of dollars in medical debt because his transplant happened when he was on private insurance. We did reach out to the co-chairs of both the Public Health and the Insurance and Real Estate Committee today to try to get their reaction to this, but none of those lawmakers were available. Live from Hartford, Mike Savino, NBC Connecticut News.